Hello, everybody. Welcome. I'm Mel Hauser. I use she, they pronouns, and I'm the executive director here at All Brains Belong. Welcome to Brain Club. Let's get us oriented to our conversation. All right, so today we've put together a panel of some of our staff talking about burnout prevention in healthcare. Before we begin, closed captioning is enabled. You just have to toggle it on if you'd like to use it. Depending on your version of Zoom, you might see the closed captioning live transcript icon, but if not, look for the more ... and choose show subtitles, or you can do the same and choose hide subtitles if you want to turn them off. If you're new to Brain Club, this is our education program for purposes of demonstrating All Brains Belong's approach to neuro-inclusive culture. It is our hope to shift broader community awareness of the issues of concern and importance to the neurodivergent community, and hopefully to promote new ways of thinking and being in the world, and so that we can all go out into the rest of our lives and carry it forward. And that is how culture change happens. While we hope that this is a place where you feel safe and supported right from your very first time, Brain Club is not a support group. It's not the right place to make personal requests or address personalized needs or situations. It's also not a neurodivergent affinity space. Everyone is welcome to come and to learn. So we invite you to listen, to learn, to observe what a neuro-inclusive space looks like, and think about how what comes up applies, if at all, to your life. There is no one right way to participate here at Brain Club. You can have your video on or off. Even when it's on, we don't expect anything of you. Feel free to walk or move or fidget or stim or eat or take breaks or anything else that needs doing. And observation is a valid form of participation. There is never any pressure to, interact directly. And if you would like to, you can do so with mouth words or in the chat. A portion of tonight's Brain Club is a pre-recorded panel, so we won't have mouth words during that time, but we will have the chat open during that time. In addition to affirming all aspects of identity, one of the ways that we keep the space safe for the collective is that we are thinking about the group's needs over that of any one individual. Lizzie's going to put in the chat, oh, we forgot. I think it's like 32 to 34 minutes is what I think that, sorry about that. And then we'll have time for questions and discussion. That is my visual support to make sure I can see the chat. And Lizzie has put the community agreement. Speaking of the chat, we invite you to use it if you'd like to. It's a great place to validate other people's comments, share how something you hear maybe impacts you. It's also a place where you can ask questions. We just ask that if you're going to use the chat, please use the big box where, the type message here box, instead of using the replies or the threads. Because the reply in the thread, what that does is it makes the chat bounce up and down, and my access needs as a facilitator are that I can't read the chat if it is bouncing. I get dizzy. So if you can please use the big box, that will allow me to respond and read what you're saying. If it's your first time at Brain Club, it's okay to not understand what's happening here, so please just keep coming back. It might just take a time or two. And Lizzie's going to put some logistics in the chat for some of the things that come up for folks when they are new-ish. Before we begin, I want to make an important announcement. All Brains Belong's medical practice has reopened to new patients this week. We are starting with accepting applications from folks whose insurance is Blue Cross Blue Shield of Vermont. Blue Cross Blue Shield of Vermont is in fact the only local carrier who has specifically promised to protect autistic people's medical records, and that's why we're starting with Blue Cross Blue Shield of Vermont, because we feel safe that we can safely provide medical care without worrying. I will leave it with that as we continue in our struggle, advocating and protecting our patients from Vermont Medicaid. Our medical practice is open to Vermont residents who have a primary care practice. We are opening space in our non-primary care track for neurodivergent kids and adults who have the constellation of intertwined medical problems that we call all the things. It's okay if you don't have those diagnoses, just known or suspected all the things. That is what this track is for. And Lizzie's going to put some info in the chat to learn more about our medical programs. All right, so June, our theme of rest. So last week we heard about barriers to rest. Now we're going to be talking. We're going to do the next 2 weeks. We're going to be talking about work, and this week we'll be talking about working in healthcare. So, you hear a lot about our healthcare practice. You hear a lot about some of the systems we have in place and how we try to do things differently. And we appreciate everyone who has supported Brain Club so that we're able to put together content like this so that we can talk about some of the systems that we have in place. And hopefully this will be helpful to folks. The status quo of healthcare for neurodivergent people, not good. We know that neurodivergent people have far higher rates of untreated medical problems and experience exceptional difficulty accessing healthcare, with nearly 80% of autistic adults, for example, being unable to access basic primary care amongst folks who have primary care practices already. They just can't go. So when we set out to figure out how to deliver healthcare differently for our patients, it's also really important to us that we figure out how, as healthcare providers, how we were going to bridge the double empathy problem. The double empathy problem, a term coined by Dr. Damian Milton, an autistic social scientist, speaking about the miscommunication and communication breakdowns between autistic and non-autistic people. And so, even as autistic people, there is still a double empathy problem between clinicians and patients. And we work very hard to make sure that our patients have multiple ways of communicating so that can know that they're heard and seen and understood. And as clinicians doing this work, I guess I wasn't ready for that slide. As clinicians doing this work, it's still hard, even as we reimagine healthcare, and we have a lot of systems in place, we are still humans and we still struggle. And it's certainly not all rainbows and ponies here. So we try to be transparent about that. And so the recording that you're about to watch is members of our medical team. Actually, the recording itself, ironically, we as a team decided to record this after a 90-minute meeting because it's like the only time we had. So this is us particularly tired. So this is us being tired, talking about being tired and the systems that we use to recover from things, from states like this, that pleased to share with you right now. And as we watch, feel free to use the chat. I'm actually going to remember that I'm supposed to make the screen full screen before I share screen. All right, here we go. Sharing screen with sound. All right, here we go. Burnout prevention and sustainability in healthcare. Can I go off script? I had an interesting idea. Olivia, Sierra, and we've worked in traditional healthcare environments, but Lizzie has not. I sort of that's interesting to me. I don't know in what way that conversation, and it was it's norms. That there were norms that you had to unlearn versus a fresh approach to the creation of something. I don't know. Does anybody have thoughts about that?
I feel like a lot of the norms that make working in healthcare difficult, a lot of the like structural aspects are very similar to working at a lot of large corporations. So I feel like there's some of them that are some of the things of unlearning is going to be pretty universal in a lot of different, especially like large systemic structured industries with a big hierarchy.
That's very interesting. That makes sense to me. Last night I had a conversation with Scott. Like, we've never talked about like the healthcare system dysfunction. Like, I guess he's like, why do you, what's wrong with the healthcare system? It's like, really? Anyway, he's like, when you talk about the healthcare system, you are talking about the business model of traditional healthcare environments. That is not, quote, the healthcare system. That is a business model that you don't agree with. I'm open to the idea, but like the business model is see as many patients as possible.
I don't think that you can separate the business model from the actual healthcare being delivered. They're one and the same. I don't know if this is okay to say, but it feels similar to being like, oh, you're focusing on politics versus like civil rights. Like they're so intertwined and yeah, I don't necessarily know if they can be separated, especially given that we how do I say this? Especially given that a lot of the business models are profit focused often um instead of patient focused.
That's fair. Traditional healthcare, see as many patients as possible so that more revenue can come in.
And to like make it actually for the healthcare to be patient focused, the business model has to be patient focused as well.
What would that look like?
I think it's focusing on patients and not profits.
Concrete thing I would say is that we see literally as few patients as possible in order to cover our expenses. Other than that, we're trying to get people appointments when they need them. Right? Like we're focusing on like bare minimum number of appointments. The schedule is set up that way. Sometimes we end up seeing more, like we were talking about before. Um, but that's the structure. It's not how many patients can we fit in the schedule. Like that is a structural difference that I think impacts my mental health and is probably good for patients. Sierra's thesis is that like if we think about like the sustainability of working in healthcare, patient-focused healthcare feels better to deliver.
I think having like patients, the community, and like direct care staff being intimately involved in like the creation of the business model is also a really important part of that. Because otherwise you don't know what patient care looks like if there's only people who aren't ever interacting with patients deciding that.
Are there other aspects of like traditional healthcare delivery or like traditional corporate delivery that anyone else has had to unlearn? Olivia, Lizzie, anything you want to share in that regard?
Well, I don't think it's possible to have patient-centered care if you're not taking care of your staff because they don't have the bandwidth, or they'll have the bandwidth for a certain amount of time and then they're in burnout and they're running on empty. And it's hard to take care of your people when you're not taking care of your staff. So,
Totally. And like I remember in traditional healthcare, there was this narrative, like people were talking about how, like, to heal a person, you must be a person, and work-life balance and mindfulness, and it was all like, you as the individual, you need to do self-care, and like then you can be a good clinician. It's like the
Mhm.
system is actively hurting me right now.
Mhm.
And so
Yeah.
I think that, to your point, it's the system
Yeah.
taking it's taking care of the people in it, which includes patients and includes clinicians and everyone who works in the system.
Yeah. It seems like and I think that it goes across the board. The companies or practices, or if they've worked in every aspect of the system, then they can at least understand where everybody's coming from and be able to show up in a different way. It seems like if to be successful and for everybody to be happy, you have to have experience in each department of your practice, or each, it's like even in restaurants, the restaurants that are most successful are run by the folks who know how each aspect of a restaurant works. Like, I've washed the dishes, I've made the food, I've served the food, I've received the food. It doesn't work if you don't, like, you can't run a successful business if you don't know how each part works. And I
Totally.
think that goes for healthcare and the school systems.
Yes, so
Yeah.
like breaking down silos like within an organization.
Yeah.
I think that's why having boards is such an important thing, whether that's like a board of directors or advisory boards, like having if we can't necessarily expect one person to have the experience of all of those different positions,
Mhm.
having bringing all of those people together to kind of mutually make those decisions.
Totally, like one of the most valuable aspects of having a board of directors and an advisory board is like the questions people ask. You're like, why are you doing it that way? Or like, have you thought of this? It's just the idea of like lots of brains bringing lots of perspectives and lots of like individual zones of genius that all contribute in the most beneficial way to the whole community. Lizzie, what's coming up for you?
Yeah, I've been thinking a lot about access needs and how I feel like our team and our model, that's a pretty um centralized focus of where we start about like what are our team's access needs, what are our providers' access needs, the staff's access needs, and then also we look at what our patients' access needs and getting feedback from them. We're kind of building this ship all together, like with all of our brains working together and also working through conflicting access needs and things like that. I don't think that the traditional models um, really start in that spot. And um, yeah, and also we look at our team and realize that it's not all about productivity and just grinding yourself down every day, that isn't sustainable. So what system can we create for the long term for
Totally.
everyone? Yeah.
It's almost like when you think about the beginning, like the beginning of being a team. So like 2023, right? So like what did we do? The first thing we did was we wrote our employee handbook together, right? Like that was really cool, of like the really unique, like, so like beginning with access needs, also beginning with culture. I don't know that I mean, also I've never been part of a startup before, so I don't know if it's like unique to our healthcare environment versus like the opportunity to like start fresh. Like, can you start fresh at any time, or can you only start fresh at the very beginning and you like want to do it well? I don't know.
I was just thinking about that too, Mel, because I think all of us have started at a little bit different times in the organization, but all of us has kind of been here, like you were saying, Mel, in this like startup phase of like creating a lot of this stuff. So we've all been here for creating the employee handbook and creating processes and that type of stuff. And I wonder, I guess I wonder how different that is to somebody coming in newly into a role where that's already been created because it's not a startup. We're not starting from scratch.
We should ask Reagan,
Right.
right? Like that would be like that'd be a really interesting future brain club, right? Because like we have systems, they work in a certain way. And like, yes, but I think that like part of the system that we created is, to Lizzie's point, it's still oriented around access needs, which is very individualized. So like the predictable system is to be individualized according to someone's access needs and to be like invited to reflect on those access needs. Like that's what I mean, it'd be interesting to see what Reagan would say.
And I
Let's
think
see.
that's another component that we have too, of when we reflect on our access needs, we see, does this system need to shift at all, any of our systems? And I think that's pretty unique too, that other organizations, the systems typically don't shift as easily or as fast based on fluctuating or different access needs.
Right. And like some of that is intentionally staying small. Like, I don't want to be a health network. I have no interest in that because I want to, at any given time, I want to be able to like change a workflow or like shut it all down, because I think, to Olivia's point, like our staff having our access needs is actually the most important thing to me. And like that, like, so it's inevitable. You know, we care about patient access needs, we care about staff access needs, and it is inevitable that those are going to conflict. And we're going to transparently name those things. Like, I have the kind of brain that I cannot have the phone ringing while I'm seeing patients. And like it's always been that way. And so the phone does not ring. Right, like that's just how it is. And I'm not gonna quote compromise on that, because it's my job to keep my brain working. I don't know what's happening, but let's give it some time. Okay. Because now that I know that is an access need, and like I think that's okay. Or I was talking with Reagan this morning, and she's like, well, in Kid Connections, people are they're like saying that they are having a hard time connecting with their match. I might edit this out, but like hard time connecting with their match because they're in different time zones. So like, what do I do? Like, this is a free community program. We actually do not have capacity to customize the time zone. This is a manual thing that a human is doing times 366 sweet little loves. We do not have capacity. We're beyond capacity to do any other filtering. So like I think it's okay to name those things. So I think that like the traditional, I mean, maybe the traditional healthcare environment, certainly a lot of like traditional customer service oriented businesses around like the customer is always right, and we're going to like bend over backwards to please quote the customer. And like I think that that is often incompatible with what Olivia has observed around taking care of staff. Like the customer, i.e. the patient may like, you know, they may want something that is incompatible with staff access needs and capacity. And like we draw a line in the sand. I don't know that that happens everywhere.
I think that that's part of why all of our job roles have been like co-determined by the organization's needs and the person's like, or and the employees like desires and things that give them dopamine and access needs, and having having that co-creation process really makes, I think, employees kind of go through and learn about our access needs and identify them, and the organization to really understand the access needs of all of its employees to be able to meet them.
That makes me think about Olivia, you and I were talking about this before, like culturally, and I think like we talk about this in trainings for employers, but it's so important that when there is a breakdown, we assume that this relates to unmet access needs, whether that is a breakdown with a patient in a communication situation or a breakdown in a task or whatever. I think that's a pretty important part of culture. When I think about like showing up to other work environments where there's like this persecutory, you dropped the ball and why'd you do that thing and what's wrong with you, and like that whole thing is so bad for health, and let alone to Lizzie's point around like productivity and performance and like all those neuronormative constructs, like those things suffer also when you come to a toxic environment where you're being criticized and made to feel less than.
Also thinking about like if most of your needs are not met, and what might seem extreme to what somebody asking for something may seem beyond our capacity to take care of, but they're coming from a place of maybe not even having any of their needs met. So what we may be asked for may seem extreme, but to them it's just another one of the things that they're not able to, take care of or have support around,
Totally, and it's always okay to ask for what you need. It just may be
Right.
the case that we don't have capacity to deliver it.
Right.
But like that's part of culture too.
Mm-hmm.
Are there other like ways of working that you think are important to note?
One thing I had written when kind of previewing the prompts for today on the more like providing healthcare aspect was that at this organization, I don't feel like my job as a provider is to like provide solutions to people, but more to make a team and like mutually create both like treatment plans, but also like create the health goals. And that feels very different from what has been expected of my role as a healthcare provider in other organizations. Um, and I think that goes to our point of what patient-centered care looks like, but also like that the 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 safety and like quality of life of employees is a priority of the organization.
Yeah, and also patient autonomy is really important to us too. Like it goes both ways. Like if I truly respect patient autonomy, I'm not going to tell you what to do. Like that has always felt really incompatible to me. And that's, it's very like patriarchal, what's that word? It's very patriarchal and like, no, that's not the word I want. It's very paternalistic and
Mm.
like feels like you're giving lip service to the idea of patient autonomy. When like I really actually respect you to know what's best for you. I'm here as your guide. I'll make some suggestions. We can co-create ways of implementing them, but like it is not it's not my job to tell you what to do. And in fact, like it feels gross to tell people what to do, and it feels gross when people tell me what to do.
But also saying that, then it may be that they actually would like you to tell them what to do, but they're not sure what that is, right? So it's like creating a space, yes, of safety where you can explore what your needs are, and then that may lead to you making a suggestion, which is, you know, also what the patient needs. But if you're told what to do, but it's not done in a safe way, right? I guess that's the key. Because you may actually want, I may actually want you to tell me what to do, but if it's not done in a way that feels safe, then you're going to be shut down.
That's so
to that.
interesting. It's interesting, like, as soon as I said the thing, I realized that, like, I don't think I really meant the thing that I said. Because, like, that what you said is so true. And, like Sierra and I, we did a group yesterday, and like what we did for all the people was we basically gave them a menu of options. You could do this or you could do that. And some people, depending on like the level of, depending on the person and whether they, I thought that they would have capacity for this, they maybe got a third choice. And there's options, and like I'll give you a suggestion. If this were me, I would do option A. That's why I gave it to you first. If this were me, I would do option A. There are also these things. Take your time and think about it. You don't need to make a decision now. And I'm gonna send you, notes in your format of your choosing, and we can talk about it again next time.
One of my phrases that I've been finding I'm using almost every visit is, here's the options. How are you feeling? Do you want to decide now? I can decide for you if you'd like, or I can send you a bunch more info and we can think about it and either talk more in the future or you can let me know. And so like giving, like you're saying, Olivia, making it clear that like you don't have to take on that whole process if you don't want to. I can do some of it, and like making that clear and giving those options so there's an explicit place where people can ask for help making decisions and that type of stuff.
The other thing about just like ways of working is like when I think about things that have completely drained my battery in other settings, namely interacting with the electronic medical record and writing progress notes in the electronic medical record, and like all of that, which I think is common, and there's lots of literature that like this ruins people's lives and leads to healthcare provider burnout and lets them leads to people quitting healthcare and all of this. So like that's another way in which we have designed our system differently. We've designed that we chart in a very flexible system. We chart in different ways. We change how we chart depending on when our need for novelty and dopamine and all of that. And I think like the biggest thing, and when I tell people about this, like when I tell clinicians about this, they're like, "What? You're doing what?" Team-based note writing. That there's multiple people. And like the thing is, in traditional primary care, that happened too. Like Olivia, you would start a note, right? You'd interview the patient, and you put the history that you gather at the top of the note, you put vital signs, and then like the provider would then like open up that note. It was team-based note writing, but it wasn't synchronous and it wasn't flexible. So it's not radical. It just looks really different that, I'm doing a thing and Sierra's doing a thing and Lizzie's doing a thing and Olivia's doing a thing, and it reduces the burden on any one person, I think.
The patients are doing part of that too with pre-visit forms.
Yes, totally. It is a co-created experience, which decreases the burden on everyone. And I think leads to patients actually getting their priorities addressed.
Yeah, I think of the pre-visit form as like a warm handoff. It's like the in-between. It's like setting the provider up for success and setting the patient up for success.
I love that. And it like allows for processing time and, just like multiple different ways of communicating.
The pre-visit form, I think that it also allows for a lot of autonomy like when you decide what you want to share, when you want to share it before the appointment and things like that. So that part is like built in to the system too, which I think is really nice.
Yeah, and like from a clinician's point of view, it also supports my processing time. It supports the information coming in visually, which supports my access needs. And it lets me think about and organize my thoughts and like do some research and do some thinking and make notes for myself so that I go into that appointment prepared. I think I'm a better doctor because I knew what people wanted to talk about in advance.
I agree. It's such a different experience. And I think the only reason that we get so many pre-visit forms and the only way people are going to fill them out is if there's that transparency of this is why we do it. This is why it's helpful for us. This is why we need it. This is why we need it for insurance documentation or our access needs or whatever. And that really, especially for a group of people who often really need the why to be able to do something.
Yeah, otherwise it feels
That's
arbitrary. It's like, why are you giving me a demand that's arbitrary? Because like I think our patients, they a lot of our patients, I say most of our patients, like feel like they are part of a community with us. Like they want our access needs to be met in the same way that we want their access needs to be met. Like that's a total sea change. Like that's a total paradigm shift. Like, oh, I had no idea that you spend hours writing notes when you're done seeing me. Of course, I want to support that process.
Like in traditional healthcare, where the provider has 15 minutes to see a patient. And I'm thinking about how much goes involved for us to see each patient, even like the pre-visit form, giving the pre-visit form, reviewing the pre-visit form, taking the time to address the pre-visit form. That alone is more than 15 minutes, So, just even thinking about that, the amount of time that each patient gets time and attention in the way we are trying to do things as opposed to a provider in, a big hospital or a big healthcare facility where they're like literally 15 minutes, 15 minutes, 15 minutes. And, no wonder everyone's feeling disconnected and burnt out and not seen or heard.
Yes. That's so interesting that you say that because it's almost like just thinking about to Lizzie's point about access needs, like this idea of the information comes in asynchronously, which allows me the flexibility of using that information according to my own access needs. So like I can review a bunch of people's stuff as a batch and organize their information as a batch. And, in a way that like when it was like patient throughout the day, there was no flexibility in terms of when do you read, when do you think, when do you organize, when do you take notes, like when do you, formulate treatment plans. Like there was no flexibility, let alone also like chart review. Like I chart review, like 6 to 12 people at a time and like look up their labs and look up with when they last time they had a mammogram and like all that stuff. We've designed for that. Anything else that we haven't talked about that you think is important?
Since the pandemic, I mean, when you're told that it's safer not to wear a mask. I mean, basically, we were told that wearing a mask is the wrong thing to do. So if you're being told that and you're already showing up, you're not showing up because you're told not to trust anybody. It's like, oh, so this is the easiest thing to do is stay out of community, out of connection, and
the safest thing sometimes.
yeah, and now public health is not being tracked or not being monitored. So it's like,
Just falling apart, just collapsing
yeah.
entirely.
Yeah.
That's so interesting. I forgot about that. So like 2020, it's like, well, we don't really know how COVID is spread. So we like, here are these rules about how you don and doff personal protective equipment. Oh, but we're not going to give you enough of it, so you're going to like ration your masks and like all this stuff that like for me was the initial breach of trust of like this is a system that doesn't give a shit about me. And
Interesting.
now we're at a place, like Olivia says, where you're just being told like, oh, it's fine. It's all fine.
And a lot of folks were getting that message before the pandemic. So the folks that have been getting that pandemic or that information since the beginning of time, that you're not important or you're not valued, they're already not trusting or not supported. And then the pandemic hits, and then there's more folks that are like, oh, you don't care about me?
Yes. So like you like and like multiple marginalized people who have this. I mean, we've been covering this at Brain Club around like just historical mistrust of healthcare in particular because of all the bad things that healthcare has done to people. And here we are.
I remember during the beginning of COVID as a staff nurse, no one on the floor was surprised that the hospital was not providing enough PPE. It was very like, yeah, this is how the systems work. Of course, they don't have enough for staff, we use them or whatever.
I remember going to the hospital and they were like, you can only use our N95s under these conditions. And I'm like, it's an airborne illness. I would like N95s under all the conditions. And like, so having to like go figure out how to like get your own N95s, like, BYO N95 to come to the hospital. Just like it was madness. And like, of course, that impacts your sense of feeling safe. And like, as we know, you need to feel safe before you can do anything. And now, like societally, all of the people who are marginalized because of disability, plus all the other aspects of identity, who like are getting the message that you're dispensable. I don't care if you live or die, and let it rip. So, ways of working, we have universal N95 mandates. Like, that's different from traditional healthcare, too. Because we care that you don't get COVID when you come for healthcare.
I'm also thinking about how we reach out to each other in the community about even the best way to connect with you. That can change from day to day for a lot of folks, like having access to a phone, having access to internet, having access to even like using your voice. All these things are like on a daily basis, and most of the world do not get the opportunity to even have that conversation.
Yeah.
And that's how people become disconnected from community, and how like get lost in the shuffle.
Yes. Right. It's the
You
people
know,
don't hear from readily that we have to figure out ways of bridging those gaps. And
yeah.
it's, often relating to like if you don't have your basic needs met,
Mm-hmm.
community feels like a luxury.
Mm-hmm. Mm-hmm. Yeah.
And you then like you don't reach out until you're in crisis.
And it
Like how
definitely
many
seems like American culture on the whole is like you don't trust anybody. So
yeah, and
like
you've been
add
hurt.
that on top of everything else. Like you grow up in a world, in a society where you're thought your neighbors are not your friends, and we're all here only to survive by ourselves. And that's,
Yeah, so you're not only unlearning, you're just unlearning so much
Mhm.
when it's safe to unlearn. And like that's a big if.
like especially under times of uncertainty and upheaval, like there's that tendency to like withdraw and like hunker down and separate, which makes sense and is really hard. Maybe one more thing I might share is like very different here compared with any healthcare environment I've been in is like I genuinely feel like I'm part of our healthcare community. Like I feel that. And so that translates into so many different things. Not only is it to Sierra's point about like patients being aware of our access needs as staff and like genuinely wanting to support them in the ways that we support our patients' access needs. There's like that, and there's just it lowers the bar, lowers the barrier for me to feel like I can be transparent about my access needs. Like, I am a human. I am showing up today. I have access needs. I'm showing up with this energy, and I am aware of the way that my energy impacts other people, and I'm gonna own that. And like, these are all cultural ways of being in space with other people that I've never seen done in healthcare that I find helpful.
Mm.
Lost my motor plan. Um, yeah, so some of the things that stood out to us as we watched that video, share screen again. So the idea of, as you heard Lizzie say, about everything starting with access needs, and we try to structurally build into like into really everything. And designing our systems to support not only patients' access needs, but ours, and to have our very patient community be involved in the creation of a lot of our systems and to give feedback on systems and to many times a year our staff is reflecting on our systems and our own experience as people working here, regularly, at least once a month, if not more than that. But then periodically also being able to have that kind of staff, that kind of feedback from our patient community is also really helpful. And I think you heard many people just talk about just the idea of being flexible. And in a world that one size fits all does not work for all, need to have multiple ways of being and to have the flexibility for those needs to change. And I think maybe the last take home point I wanted to highlight is one of us, I forget who it was, somebody talked about just the idea of like when there is a breakdown, we presume that this related to unmet access needs. The other day, I think it was last week, I accidentally deleted something that was important. Like a structural thing that I deleted, and we're having to like recover it and all this. And like I genuinely was aware, because I talk about this all day long, like yeah, there's just a breakdown relating to unmet access needs. And now my responsibility to sort of like be curious about that and wonder about that and seek support around that. And but like the first thought, and I think this is like just comes from like is the result of culture, is that so many times when people are in environments where they make a mistake, and there's blaming and shaming and what's wrong with you, and it's just not helpful. It's also, just has you on the wrong track entirely. So, with that, I'd love to hear from some folks, if there is anything that has stood out to anyone that they're going to be taking away from today. Sierra.
I feel like there was a lot of me talking today, so I wanted to other people. But I think one thing that really stood out, it was pretty early on when you were talking about conflicting access needs, Mel, that when you're in community, you often need to prioritize the community's access needs over an individual's. And when we talk about that in organizations, it's often, I think, traditionally thought about as like, okay, you need to prioritize the profit of the organization or the like financial stability. And really how it should be is like you need to prioritize the accessibility of the organization and the stability and the good of the community. And those are, yeah, we're just focusing on the different needs. We're focusing on the wrong needs. Yeah.
Yeah, I think like what comes up for me when I heard you say that, I didn't know where you were gonna take that, but like I might spin that a little bit about, sometimes when people talk about sustainability, they are talking about finance, like financial sustainability, like we can do this because we brought in revenue. Whereas like when we use that word sustainability, it's like I need the staff to not burn out and quit their jobs, right? Like that's the sustainability of the work that we do. I think that itself is a shift that I don't think came up in that as clearly in that panel.
Absolutely agree.
Joe, hi Joe. Uh-oh, I lost your sound. No sound.
Can you hear me now?
Yes.
Okay. I love that it's always whenever time I'm here, it's always timely, and that's one of the biggest things I'm seeing right now with a bunch of changes that are happening across the state in the healthcare system in general, but in mental health and in developmental services and payment reform is the sustainability in terms of burnout and because right now it's almost like panic mode across the board to try to stay on top of these changes that are constantly coming. But it's been like a moving target ever since the beginning of COVID. We expected during COVID things were gonna, be kind of upside down for a while, and you're just gonna have to do what you can to power through the storm and stay on board and not capsize. But the pandemic's over, but these changes, these things keep coming, and it's so I think, especially in human services field, you just hit it right on the head with the importance of. I've always said when direct support, that one of the best ways to support the people that we're called to support is to support the people around them too, their families, their friends, their communities, the support workers, paid, unpaid. So a lot of ways this all kind of relates. You're talking more in the medical field. It does relate. My wife works in mental health, and it's burnout. She's been there 3 years, and she was told by our counselor today that 3 years is a long time for somebody to work in this field.
What a disappointing trend.
Yeah.
Yes. Yeah, absolutely. And especially because I think for so many, COVID's not over. And I think that like
Right.
when
Yeah.
it's really just that when the system goes on and like tells you that we're just not going to support you anymore and we're just gonna, expect you to suck it up and push through and all of this, it's yeah, no wonder comments like Vinny's as an ex healthcare worker who has already burned out of the system, not even knowing at the time that I'm autistic. This was also validating to hear. Thanks, Vinny. I'm glad you're here. And Alvar says, to me, that's part of community that's often lost as far as employees being seen as replaceable. Yes, exactly. Um, exactly. Because that's the essence of profit over personnel. Yeah, absolutely. Yep. Yeah, and as Nancy's pointing out, it's not just healthcare; it's in so many other industries. And I think kind of like the radical reimagining is, well, when people have their access needs met in any field, they are more likely to be able to do their work. And I think that even in a traditional sense for sustainability, like actually talking about, the financial bonus, we think about like turnover and, all of this, it actually is both definitions of sustainability. By focusing on access, you actually do achieve financial sustainability. Yeah, future proofing. I love that, Nancy. Yes. And so with that, thank you all so much for being here and being part of this important conversation. Next week, we will be bright spotting members of the ABB community, talking about their experiences with work, both in finding employment that has worked for them, and for many, creating their own. So we look forward to you joining us next week. Have a good week, everybody. Bye.